Ladies and gentlemen, dear students, every year the Christmas carol singing takes place at the soccer club Union Berlin in the Alte Försterei. Berliners know this event. In wind and weather, 30,000 people sing Christmas carols together by candlelight. There are now 40,000 in Cologne, 20,000 in Aachen, with many other events in other cities with large stadiums and soccer clubs. The feeling of shared emotions, the synchronization of one's own mood with that of others, the growth of social cohesion. If I didn't care about someone yesterday, I could hug them today at O du Fröhliche. We beam over to the intensive care unit for premature babies. Their tiny creatures lie on 1,000 infusion tubes. And then the music therapist comes and plays delicate sounds on the lute. The tiny babies respond to this. They flourish better, they mature faster. People with severe mental illness form a figure out of a lump of clay, and after a long illness realize that there is something inside them that was buried and is now taking shape in the truest sense of the word. They believe in themselves and their abilities again. Anyone who has ever been in a hospital knows how depressing the standard hospital architecture is. Neon lights everywhere, white washable walls, indefinable beige gray floors. Can you get healthy here? No. Well-designed hospital architecture can be healing. Art in the broadest sense and the health of individuals and populations are linked. There are many pieces of the mosaic of scientific knowledge, and yet we are only at the beginning of recognizing the great importance of art for people. With every finding, a multitude of new questions arise. How does it work? What does music have to do with blood pressure? What does choral singing have to do with social cohesion? Why do people engage with art? Are art treasures from the Stone Age, we know from museums, show us that humans have already made time for art. Why? Have humans known about the beneficial significance of art from the very beginning of mankind? How can we answer these questions? What perspectives are there on art and health and well-being? With our lecture series, Healing Arts, we want to approach these questions step by step and find and reflect on answers with experts, but also with you in the audience. The lecture series also already has a longer tradition. I think it's the fourth course this term. It was initiated by Lukas Feireis, a curator, author, and educator who works internationally at the intersection of art, design, and theory. He's a board member of the International Society for Arts and Medicine and has curated numerous exhibitions and symposia worldwide. Lukas also developed experimental teaching formats, and since 2021, he's been exploring new models of artistic education at the Berlin University of Arts. The Healing Arts lecture series first took shape in this context. Unfortunately, Lukas cannot be here today, but he will take over the moderation from us at the next event in 2 weeks. Let me still add a few words about the process of this lecture series. Across 5 curated sessions, the series will bring together perspectives from neuroscience, ethnomedicine, gender studies, performance, and societal health issues. The sessions start with an input of approximately 15 minutes from each of the two guests, and various questions will then be explored in a panel discussion. And we look forward to reflecting on the future of health, healing, culture practice, together with you all, with students, researchers, and with the interested public. Finally, I would like to provide some organizational information for our students here. You can earn 1 ECTS point by attending the lecture series and completing the associated homework. This requires attendance of all lectures and the writing of a reflection of at least 1 page on each lecture. Yeah? Please send the reflection to me by email by the Monday morning before the next course at the latest. So maybe I can quote one or the other reflection or a part of it in the next event. And at the end, finally, I would like you to write a summary and an outlook on the event series as a whole. I will then issue the certificate to you. And for all students who want to register or have already registered, there's a list where you can sign and say that you have attended the event today. So I now hand over to Vanessa.
Thank you very much, Anna. It's a pleasure to open the Healing Arts series of this week. Do you hear me? Test, 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 test. Yes, okay. To open the series together with you and to introduce our first 2 speakers. Our first speaker tonight is Professor Dr. Friederike Kendel. She's a psychologist at Charité, where she has worked for over 2 decades and now leads the interdisciplinary group Patient Empowerment and Prevention. But her connection to the arts runs just as deep. She is a professional cellist and studied in Freiburg, Cologne, and in Moscow when she was among the first West Germans who received a DAAD scholarship for the Tchaikovsky Conservatory. Her fascination with how the brain processes music led her to psychology and eventually to medical psychology. She also co-founded the Musicians Medicine Network and teaches the interplay between music and medicine. We are thrilled to have you with us tonight. But before I give the word to you, I will also introduce our second speaker, who is Dr. María López-Fanjul y Díez del Corral. She holds degrees in art history and museum management from Madrid and London and a PhD from the Corral Institute of Art. She has worked with world-renowned institutions such as the Museo del Prado and the Staatliche Museen zu Berlin. And since 2017, she has been the curator of the Bode Museum, overseeing the Italian and Spanish collections and leading its academic outreach. And her most recent initiative is the Healing Museum, which explores mindfulness and meditation in the gallery space and opens up new ways of engaging with art as a transformative experience. We are so glad that you can join us tonight. And we'll begin with Professor Friederike Kendel, who will share some insights from her dual perspectives as a medical psychologist and musician. Friederike, the floor is all yours.
So, thank you very much for the kind introduction. First, I would like to thank the musician of today or here. I don't know, maybe like that, because the medical students I have taught over the years are really my great inspiration, and it's just great fun, and I'm the one who's learning really a lot every year. So, as you said, I was interested in the brain after my musical career or during. I always wanted to know how the brain processes music. However, I ended up specializing in medical psychology. In another interesting field in the Charité, working at the intersection of medicine and psychology. My research focuses on how cancer patients cope with their disease and how we can improve their quality of life. But since the beginning of this year, I've been working with my research group in the Department of Anesthesiology and Intensive Care Medicine, headed by Claudia Spies. And she's also interested in music and music interventions because in intensive care medicine, promising developments have emerged in the use of music for healing. And so for me, I'm very happy that the circle from music to psychology, to medicine, back to psychology, back to music seems to close. So I have to open the oder
Freigeben.
freigeben.
Und dann ist es das hier.
Ja.
Super, dann ist man mal drauf. Sehr gut.
Und jetzt brauche ich noch, ist das die?
Dann kann man hier auch noch drauf drücken. Jetzt die Präsentation direkt. Und dann sollte man hier
Oh, I'll let you do that.
Bildschirmpräsentation.
I'm the technician.
Unten rechts.
Vielleicht Bildschirmpräsentation von Beginn an.
Ja.
Yes. Yes. So you can see it, now. To a few things. So get ready here. So take a look at the facial expressions of the small figures of the 15th century from the Bode Museum. I suppose they would have played something like you heard in the very beginning if they would live today. So music is something we experience through our senses. I would therefore like to start with a short excerpt of the song Yokohama. 1 minute. This was Yokohama. Did you like it? What did it change for you, or what did you feel? Joy? Like the upbeats. Yes, I think, I suppose most of you found the music cheerful. However, each of you will have experienced the piece differently. And this leads me to some preliminary remarks. So first, music, we often say, is a universal language. But the perception of music is individual. It depends on previous experience, mood, personality, and culture. Someone who could listen to or could understand the lyrics would maybe have perceived that differently. We say music works for very different diseases. I must say, if someone came to me and said, look here, I have a medicine that works for almost everything, I would probably laugh at him and think that quite esoteric. But music is a special case because the mechanisms of action differ depending on the specific disease. Yeah, yes, I can take the microphone. Okay. Third remark, experience shows music is healing. But experience and anecdote are not enough. The specific mechanisms at action are not yet sufficiently understood. But we know at least something about basic mechanisms of action. And I'll show you the 3 mechanisms that are at work virtually every time we listen to music or actively make music. The first principle is that music induces widespread activation of various networks in the brain. So on the left side, you see a picture of the brain as viewed from the outside. On the right side, you see a cross-section of the brain, so the inside of the brain. The colored dots on the figures are results from functional magnetic resonance imaging studies in healthy participants while listening to music. For those who are not familiar with fMRI, this is an imaging technique that shows which parts of the brain are active by measuring changes in blood flow. So kind of like seeing which areas light up when you think, feel, act. In our case here, listen to music. I'm starting with a green dot or dots that represent the basic auditory pathway. We have an auditory signal from the air. The signal goes through the auditory system and reaches the auditory cortex inside. This is a sound, but sound alone is not the same as music. Music, of course, involves much more than pitch, loudness, or duration. It is like a language. And this is why also the musical syntactic network is involved in the processing of music. These are the dots in light blue. Here we perceive higher order musical features such as harmony, intervals, and rhythm. Music also involves the attention and working memory that we need to focus and being able to keep track of music and time, comparable to a sentence that has a beginning and an end, the pink dots. We need to follow the entire course to understand the content. Music involves our recognition and episodic memory, the purple dots, that enable us to associate music with specific memories and recall music from the past. The dark blue dots represent the motor cortex. This network becomes active when we sing or play an instrument or when we move to the beat of music. This is true not only when we are actively playing an instrument, but also when we are listening to music, especially to music that we have played before. Our motor cortex will be active. Last but not least, but of course very important, music evokes emotions, which are represented by the red dots deep inside the brain and very old from an evolutionary standpoint. Depending on the particular piece of music, we experience specific feelings. If we enjoy the music, the nucleus accumbens, I don't have a pointer here, the larger dot, is activated, but music can also evoke sad and anxious feelings being processed, for example, in the amygdala and other regions deep in the brain. So, taken together, music is very demanding on the brain. It involves understanding, rhythm, and emotion, and it is processed in the entire brain. To demonstrate this, I'll show you a short animation how the brain is activated when listening to an Argentinian tango by Piazzolla. The animation is, again, based on fMRI data and statistical modeling. This means the data is not based on one brain, but 11 brains taken together. You may want to pay attention to two things. The redder the color is in area, the more active it is. And look at the areas in which harmony and timbre is being processed. For example, here on the left side, the red areas now. Okay, I have a pointer now. Excellent, thank you. So again, very short video, only an excerpt of the whole thing. So I think you could see how the brain is activated listening to music, the first principle. The second key principle concerns the influence of music, and we need that urgently in the hospital, on the autonomic nervous system. This system consists of the sympathetic nervous system, which activates the body, and its counterpart, the parasympathetic nervous system, which ensures relaxation. So we can make usage of that. When you listen to music, the hypothalamus activates the autonomic nervous system via the brainstem. This system controls automatic body functions like heart rate, blood pressure, and breathing. Music can thus make your heartbeat faster or slower, change your breathing rhythm, and even influence digestion or skin temperature. This means that we can use music to speed up or calm down our heartbeat, depending on the music that is played. To demonstrate how music can have a calming effect, we'll listen to a short piece by Bach with a tempo of around 60 heartbeats per minute. This is slightly slower than the average heart rate you have. When you hear the piece, maybe don't try to analyze it. Just enjoy the music. If you wish, you can close your eyes and breathe in time with the rhythm, inhaling for a few beats and then exhaling. So I suppose this music had a more calming effect than the first piece of music we heard. And we can make use of this if we use it in, with the patients who are very anxious in different settings. So the third principle is that music also affects the second stress axis, the hypothalamic pituitary adrenal axis. This pathway is often referred to as our wet pathway, as signal transmission takes place via the release of hormones into the blood. Cortisol, a very important hormone, stress hormone, which is released at the end of this cascade, is often called the stress hormone because it's released during physical and emotional stress. It helps the body to mobilize energy and has a variety of other functions, such as anti-inflammatory effects, controlling blood pressure, and regulating the sleep-wake cycle. Depending on whether the music is calming or stimulating, it can either lower or raise cortisol levels. For instance, meditative music can alleviate stress and anxiety. In contrast, intense music can temporarily increase cortisol levels to boost energy. So it was a very short overview. In summary, music activates a wide network of areas in the brain, including areas involved in memory, attention, movement, and emotion. Music can activate the autonomic nervous system, and it activates or calms the stress system via the HPA stress axis. I think we'll later discuss where and how we can use the music. We can make use of these principles in the treatment of various diseases, but music is much more than neurons firing together or the release of neurotransmitters. It is part of our life. It may help us to maintain our integrity and dignity, even if we feel weak and helpless. That said, the last video I want to show you is of the former ballerina Marta González Saldaña, who had Alzheimer's and died in 2019. In this video, she is listening to a recording of Tchaikovsky's Swan Lake, a ballet she had performed many times during her great career. This is not just about music, it's also dancing, art, how to bring different arts together. And with this verse, I'd like to hand over to María.
Did you?
Yeah.
The presentation is here. Wo habt ihr die Präsentation abgelegt? Ja, Stick.
Sie meint vielleicht hier?
Auf dem hier? Die hier.
Ja. Nee, PowerPoint, genau. Hier, da, einfach.
Hier?
Ja.
Okay, dann müssen
Wie kann ich wechseln?
wir
Einfach
müssen noch
auf
ganz
die
kurz-
rechte Seite.
Möchten Sie direkt die Präsentation haben?
Ja.
Ja. Dann machen wir hier freigeben. Der hier. Super. Und dann einfach hier. Nah ans Mikrofon.
Gelernt.
Dear guests, dear colleagues, dear friends, as mentioned some minutes ago in my presentation, I'm an art historian. Although I've always struggled to free myself from imposed limits and boundaries, especially when they restrict my fields of research and interest. In fact, if I had to define my profession, I would say I'm a humanologist, if such a word existed. For as long as I can remember, my research and scholarly interests have focused on the human being. I'm fascinated by trying to understand why we are the way we are. The study of art has been a fundamental tool in helping me to understand us humans, but it has not been the only one. Only by studying a work of art in its historical context can we truly grasp its essence. This means analyzing it in a transversal way through various disciplines, including history, literature, philosophy, sociology, music, ethnography, economics, anthropology, gender studies, theology, and politics, among many others. Since 2020, for me, this long list also includes the field of neurosciences. I did not come to the decision to include neurosciences in my list by chance, but rather through my own historical context. This historical context was influenced by a story that I would like to share with you. It is a story without which the project, the Healing Museum, Mindfulness and Meditation in the Gallery wouldn't exist today in the Body Museum on Berlin's Museum Island. On the 10th of March 2020, I traveled from Berlin to Madrid, Spain, my country of origin. to bury a relative who had suffered from multiple sclerosis for over 40 years. My sister, who was living in South Africa at the time, and several other relatives living abroad did the same. On that day, the world seemed to be at peace, at least to most of us. 3 days later, I was the only member of my family from those living abroad able to return home on one of the last planes to leave Madrid. Just hours before, the Spanish government closed the country's borders, and the Spanish people were then locked up in their homes for 3 months. It was the beginning of the pandemic. On the 16th of March, I started coughing. I had been infected with COVID in Madrid. During those chaotic early days of the pandemic, my body began to shut down until I eventually had to choose between breathing and talking. I was taken to hospital in an ambulance without being able to say goodbye to my husband and children, who were then aged 8 and 5, and from whom I had been isolated for 10 days. I was well aware that I might never see them again. A couple of hours later, my husband was contacted by the social services. They told him that they would take the children if he got sick as well. In Madrid, my whole family was in the same situation. All 12 of them had been infected. Like me, some of them ended up in hospital seriously ill. To put it briefly, in just 10 days, I was facing my own death, the death of a large part of my family, leaving my children alone in the care of social services, and all this without any possibility of action. Or so I thought. I can tell you already that this story has a happy ending. When I came home from hospital many days later, I could barely walk. I couldn't read. I still struggled to speak. The only thing I could do was sit on the balcony, listening to Chopin and admiring the blossoming spring. In 2020, the Berlin winter gave me the best gift possible. It let my geraniums from the previous year survive. So I spent the following weeks admiring the unfolding of life, the hope of constant change. As time passed, the condition known as long COVID emerged, bringing with it a range of challenges, including mental fog and insomnia to overcome. Moreover, while I was struggling to recover, I also had to support one of the most important people in my life through deep depression resulting from isolation during the pandemic. Just a couple of numbers. In Germany, during the pandemic, the number of people seeking psychological help increased by 500%. Today, absenteeism from work has increased by 50%, mental health being the main reason. In those moments, I did the only thing I could to take care of my mental health in the face of a future that seemed very bleak. To admire how the green shoots on the brown half-frozen stems of my geraniums turned first into buds and then into flowers. This photo corresponds to those days. I took it so that I wouldn't forget, hoping that maybe at some point I would need to be reminded that I had gone through all that. Today, this photo is in my living room, reminding me that I'm much happier now than before the pandemic. Those geraniums became my first contact with meditation, even though I wasn't there aware of it. As Jon Kabat-Zinn would say, this is my own story of full catastrophe living. For those unfamiliar with it, Full Catastrophe Living was the title of the first book by Dr. Kabat-Zinn, who revolutionized the treatment of stress in the 1970s, thanks to his mindfulness-based stress reduction program, MBSR, which is based on Buddhist Vipassana meditation. He implemented this program with worldwide success at the University of Massachusetts Medical School. Since then, mindfulness the ability to focus our attention on the present moment has become one of the most well-established practices in 21st century Western society to manage any kind of stress. A practice, a skill that can be developed through silent or active meditation. Discovering modern mindfulness was part of my path to healing, but it was not the first step. The first was Frédéric Chopin while I was in hospital, then my balcony when I was taken home, and afterwards my interest as a historian in other cultures that led me to discover first Buddhist meditation practices before finally arriving at 21st century mindfulness. Today, exactly 5 years later, and with an established routine of 1 hour of daily meditation, I'm fully recovered from the long COVID, and my life has completely changed for the better, for the much better, since pre-pandemic times. And it seems that I'm not the only one. In June 2020, when I was starting to face the long COVID symptoms, many Spaniards began to discover a new world, that of museums. The Spanish government recognized culture as an essential good, and museums reopened almost simultaneously with the lifting of the first lockdown restrictions. They opened for free, waiving the admission fee. They became relevant, fundamental, and essential places for mental well-being. They were visited by people who had never been before. Spanish museums immediately became centers of active meditation, albeit unintentionally. Since then, there has also been an exponential increase in the number of people and governments who care about improving mental health through active mindfulness meditation in museums. In 2018, even before the pandemic, Canada became the first country to allow its physicians to prescribe museum visits. Since 2021, Sweden, Belgium, Switzerland, and Great Britain have joined this initiative known as museum therapy, which is led by the ministries of health in all these countries. The initiative is very simple: to encourage and facilitate people to visit museums. Neuroscience medical studies show that visiting art museums reduces stress and anxiety and consequently improves mental health. As contemplating works of art and walking through museum galleries helps us to develop mindfulness. In other words, art museums are places of emotional healing. This is why, with these studies in mind and with the background of my own personal history, I've been working at the Body Museum since then to actively support the mental health of Berliners and to open up new paths of research between art history and neuroscience, which will hopefully bring this topic to the forefront of academic research and exhibitions in museums. The first project was the Body Museum Your Refuge, a suicide prevention initiative developed in collaboration with Caritas and anchored in the Body Museum since 2023. And since the beginning of April 2025 with the project The Healing Museum, Mindfulness and Meditation in the Gallery. This second project goes a step further than what has been done so far in the other 5 countries I've just mentioned, as we intended to permanently combine the active practice of mindfulness meditation with museum therapy, historical artistic research, and medical research. Furthermore, thanks to the generous support of multiple sponsors, we are offering 2,000 free tickets to the public, eliminating the need for a medical prescription. We have converted one of our main rooms into a permanent space for mental health self-care, for the historical study of meditative traditions, and for medical research, putting the project at the disposal of the most important university hospital in the country. That means you, dear colleagues of the Charité. The Healing Museum project consists of 3 interlinked pillars. The first is the series of guided Vipassana meditations in German and English. This can be accessed free of charge via our audio guide, on your mobile phone using the QR code in the room, or on our website. These meditations were developed in cooperation with Vipassana at Home. We also provide Safus, meditation cushions, for meditation practice, courtesy of another of our partners, the Berlin company Futomania, part of the social integrative company Pfefferbett. The second pillar is the exhibition you can see in this picture. Meditation is not a trend, just as we are not the first humans to go through a pandemic, nor are we the first to live through times of great political uncertainty. In fact, if we think back at school, we were told the history of humanity through revolutions, wars, and pandemics, through a common thread guided by moments of crisis. With the project The Healing Museum, we wanted to turn the historical narrative upside down and explore not the crisis, but the tool that humans have been using for centuries to cope with them: meditation. When we look at a work of art, we tend to forget that the people depicted in them existed before us, that they had very similar problems and also had to find tools to achieve happiness and overcome crisis. Well, all the people you see represented in the works of art in this room were meditators. In this room, we exhibit 20 wonderful paintings, sculptures, and other objects from our collections of European art and from the collections of the Museum of Islamic Art, the Ethnological Museum, the Museum of Applied Arts, and the Museum of Asian Art of the Berlin National Museums. Works that we have not studied from the traditional point of view of attributions or artistic qualities, but from the connection with the history of the meditative traditions of Buddhism, Islam, Stoicism, and Christianity, and their impact on today's mindfulness. And it turns out that if we study the history of the human being through the history of meditative practices, we discover that meditation is a common ground for the different philosophical, religious, and cultural traditions of humanity. It is a point of interreligious and cultural union. Buddhists, Christians, Muslims, and Stoics all apply very similar meditative techniques, and all four traditions have influenced each other throughout history, something we can learn from in these times of crisis and political division. Moreover, Berlin and the Bode Museum also know a lot about catastrophes. Like Berlin, the Bode Museum survived the 2 world wars, the Nazi era, and the division of Germany, and is equally affected by the current crisis, including the pandemic, which forced it to be closed to the public for almost a year. If the museum has overcome all this in its 121 years of existence, imagine what the objects in our collections, which are centuries old, have overcome. The fact that the museum is open today is testimony to its resilience, to Berlin's resilience, to the resilience of art, and to our own resilience. Finally, the third pillar of this project is the cooperation with the Experimental and Clinical Research Center, a joint institution of the Charité, Universitätsmedizin, and the Max Delbrück Center, a pioneering interdisciplinary cooperation that allows us to unite art historical and medical research, and through which we hope to study the impact of museum visits and meditation on patients with multiple sclerosis, the illness that took me to Madrid in March 2020. The circle of this story closes. As you might expect, the project The Healing Museum is also a statement. As in most other countries, museums in Germany were closed during the pandemic. They were not, and still are not, considered as essential service by the government. They were seen merely as places of leisure and entertainment with no public utility or relevance. In doing so, citizens were deprived of a fundamental tool for caring for their mental health and their humanity. After all, if there are 2 characteristics that define us as humans, they are the capacity to be mindful of our own happiness and the capacity to create art. Thank you very much.
Thank you very much, Maria. I would suggest that we now come forward and continue this discussion together with all of you in front of you in a panel discussion. So please choose a seat, and we have. Gives this one to you. Yes. Okay. So you both shared enormous and wonderful ideas, and we would like to reflect together on them a little more. As a first opening question, I would like to ask both of you if there was a moment in your work or personal life where you could feel that art and healing came together. Maria, you shared a little bit of that already, but maybe you can reflect on that a little bit more. As either way, one of you who wants to start.
Yes, I think I would like to share one very personal story because your lecture really moved me. About 5 years ago, a very dear friend of mine was in the intensive care unit in the Charité, and after cancer diagnosis and then surgery that didn't go well. He was in the intensive care unit and was mechanically ventilated and deeply sedated, and nothing could reach him at that time. No voice, no reaction, really barely nothing. And then I played. I knew which music he loved. He was a mathematician, but he was also a pianist. And I played his favorite music for him. And suddenly he squeezed my hand. And now a few years later, so it's still, the feeling is still there. I was very grateful that I could play the music for him in the situation, that he heard it. And it gave me some comfort later that that I could still connect with him. And so since then, I then read a lot about hearing and sense of hearing in these situations, and I now know that the sense of hearing is the last sense that is lost. And I think that's why it's so very important to, we all should know this and bear it in mind that if we lose someone, that we maybe even ask ourselves, what would we like to hear in our last hours? So it's a great motivation for me.
Now it's on. I was just briefly talking about Chopin. When I was taken to hospital, I was put in a room for 6 people actually, and I was alone. We were all isolated, and in all the days I was there, I was not able to see the face of any of the people caring for me because most of them they didn't dare to enter the room. And the only 2 persons who came in, they were fully dressed and covered, so I never saw their faces. And as I said, I couldn't read, so the only thing I was able to do was to listen to my Spotify music, and the only classic music I had on my list was Chopin. So it saved me, but I would say there is another story which has to do with meditation. I'm working now for almost 2 years with Reimer, with a meditation teacher. And one of the things that were hurting me the most when I had long COVID was that I was unable to dance. And dancing in my family is extremely important. So he taught me to dance without moving. He taught me that we have the music inside. Even if we don't have music, we just have to listen to it. So
And as I showed before, there is a lot in the brain, in your brain. You're also activating your motor cortex if you do that.
But if you listen to yourself and you let your body move, you start moving, you start dancing as nature.
Yes.
Yeah, or I try to speak very loud. Maria, you invite people in the museum and to meditate. And sometimes without them knowing that they're going to meditate if they come into the museum. Can you reflect a little bit or share with us what happens when they stumble into such a situation and how they react or what is happening then?
I cannot tell you what they feel or think. I can tell you what I would like them to feel and think. And museums of pre-1900 art, we do have a big problem. And this big problem is that people think they have to come to us with pre-knowledge, that they need to know something in order to understand, something that doesn't happen with music. You listen to Bach and you feel Bach. Nobody waits for you at the end of the concert and makes you a test. But this is how people feel when they come to us. And I said, this is an enormous problem we have. So what I would like people to feel and not to think when they bump into the Healing Museum is actually first surprise and then freedom. Freedom to experiment the artworks the way they want. There is no one way. Art historians have nothing to say about the way of looking at art. You said it before, Friederike, every piece of music tells something different to each of us. There's a different, every art object collects thousands, millions of different stories, of glances from each of us. So this is actually what I would like them to feel and not to think.
May I specify this question? If you could redesign the Bode Museum, with this in mind, what you said, hoping the cultural ministry is not listening here. You should, but maybe it takes money. But beside this, what would you change?
Well, maybe I will start by telling our audience that the Ministry of Health is all of us. Thanks God we live in a democracy. This means people sitting there work for us. So if we want our museums to open, it's us who have to ask for it and not just to complain that others don't do the work for us, first of all. And second, if I would have enough money to reinstall the Body Museum, I'm sure first I will try to make a group of people, not only art historians, but also art historians, who would help us to think out of the box. And second, I will ask them to help us to redesign the museum in a way that the museum is relevant today for the most of us.
Actually, gives the same question to you, speaking from the medical experience and knowing about what music can do to us humans. How would you redesign a hospital? What would you change?
So I would go back a little bit. I think everyone who experienced being seriously ill knows, and many authors have described this much better as I can do that. Solzhenitsyn, the cancer ward, Susan Sontag in Illness as a Metaphor, for example, or Herrndorf in Arbeit und Struktur, how you, if you become seriously ill, you feel like a stranger in a world you no longer belong to. And I think music can give you some, or connect you with the world you lived in before, and give you help you restore your integrity. And I would, I think if I could choose, I would offer music to our patients, but as an offer, I think it has to, can't be more than an offer, because it's so different, and every patient needs maybe different music or no music sometimes. Yes. But yes, we will discuss this with the plenum. I think what ideas are there?
That brings me to one thing that you both mentioned. So art and music is about connecting people, but the perception itself is very individual and personal. Do you think healing itself can be a shared experience?
The healing itself? Well, what I have tried at the Body Museum with the project The Healing Museum is not to share my healing, but to share one of the tools that helped me. Nature and sport were the other two tools, apart from my friends and family. So maybe these are the next projects.
Yes.
So the tools. Mm-hmm.
Then I have also one more question that I was wondering when I heard listening about you, because you talk a lot about what you gained throughout your work life, throughout being in touch with music and art. Is there something you think we should unlearn in order to experience art as a healing mechanism, or something that we should, unlearn is maybe the right word?
Everything. Actually, to experiment art, I think we are afraid of letting art touching us. We are afraid of crying. We are afraid of laughing. We are afraid of feeling, so that we don't get hurt, and learn and enjoy.
Yes, I of course I went to the Bode Museum to prepare for this lecture, and what is new for me, it was to really the offer was to look at the pictures without reading the text, and this was great. But I mean, music. We don't have the same problem with music, because usually we don't, there are some modern composers that we have to learn much about before being able to listen to it. But maybe even then, I think we should listen to them much more. Would be great to just, get in.
Well, you have maybe kind of, I don't like to call it like a stir, but depending on the complexity of one thing or another, you need maybe to prepare yourself better, or not. Maybe some people would reach it without. Yeah, the problem we have at the Bode Museum, well, the challenge, I don't like to talk about problems are something else, is that people don't make the difference between European art and Christian art. So they usually come to us and say, this is, excuse me, a museum of Christian arts. Like, no, this is a museum of European art until the 20th century. So many people are, again, emotions, like starting the visits with a negative emotion before realizing that it's about our own history, the history of Europe. Something you don't have, a challenge you don't have in music.
Friederike, may I ask you, you said that we don't have such a problem as Maria talked about in music, but don't you find that in many situations where we hear music, we are not, or we feel that we are not allowed to show emotions, or that we are not allowed to react openly to the music? If you go to a concert in Germany, you see around yourself 2,000 or more statues. But if you go to a concert, for example, in South Africa, I've visited a classical concert in South Africa, everybody is moving and enjoying their own emotions and feeling. Don't you think that for really finding the healing moment in music, we should change our culture of reception in Germany, in Europe? Don't know. In our
Anna, I think this is a very nice idea. I don't think this is appropriate for every setting. I think we should have these places, definitely. And the Berlin Philharmonic, for example, they play in the Waldbühne, and this is much more. You can move there, you can eat and drink and enjoy the shared experience. But sometimes we need music as a really calm place where we kind of meditate. And I think I can yes, only speak for myself. I can't meditate if there's too much noise around me. So I also like sitting in the Philharmonie or somewhere where people really concentrate. But also in the Philharmonie, they have these lunch concerts, for example, that are much more open, and people go there and yes, walk around, move, and I think it depends.
Depends on the type of music. I was lucky enough to attend the last concert Leonard Cohen gave in Berlin. I was pregnant 8 months.
I was there.
Yes. And then maybe we were the only one dancing, because I was coming from Spain where you don't get seats when you go to a concert of modern music. I was kind of very surprised being the only one dancing. And I recommend it.
So I think it could be worthwhile to open now the question to the audience. Maybe there is a first, you can give comments, you can ask questions, whatever you want. Please, just for organizational details, if you can speak directly into the microphone, then your voice is recorded. But you can also ask, and I will repeat what you have asked for the remote audience, the participating people outside.
I want to make the contrary argument in favor of learning, because I think that maybe actually we need the same thing, but for me learning is very, very positive, and I feel that sometimes we think about learning as just making our head and our eyes get closed, and I think that learning, if it's good learning, can also really open yourself up. And I really felt like this in many situations in my life, that the more I learned about something, the more I was open and the more I knew what to look for, actually. And then when the first time, for example, to the ballet, I had no idea about it, and I was somehow, I had some kind of feeling. But then the more I learned about it, the more I discussed with people that know more than me, the more I understood what to look for, and the more I got involved, and the more rich the experience was for myself. So I think, I mean, there's a dual aspect of learning, that it can really open, and it's also good to learn.
Let me shortly repeat for the remote audience. The contribution was that there are that the word learning could be interpreted in different ways. There's a dual. You said a dual definition of learning, and learning can also mean that you open up your mind, yet that you open your eyes and ears, and learning means to become open towards different impressions and something new and innovations and all this. And learning, so unlearning, the word unlearning we used here could also mean that you actively learn something new by opening your mind and your experiences. Yeah. So Friederike has a.
I would like to respond. Thank you so much for the comment, because I think the activated brain I showed should exactly tell us something about that, because it's not only passively listening to something, because if art is about striving, engaging, learning, and the more we learn, the more we engage, the more connections we have to other areas to other senses. And I think also the ballerina I showed at the end is also a great example. This is a woman who all her life she trained, she learned, and now everything is connected. Yes.
Oh, yeah, just. I absolutely agree with you. My problem is with one-way learning. That there is no, and I was saying before that the importance for me of transversal learning, of always seeking new fields of research that I can combine with my previous research as an art historian to be sure that life is not so easy, that it's complex, and so we have to learn not in a complex way, but in a multi-way way.
So here's a question.
Thank you both for the wonderful input and very interesting one. And maybe this is an informed question, because my expertise lies in museum outreach, but not really in music. But I have a feeling every time I see the brain scans, it's about classical music. Are there any researchers about techno or rap? What does it do to our brain?
Oh, thank you so much for this question. Yes, for example, there's research on heavy metal. And I don't know whether you, for example, you know the sociologist Hartmut Rosa, who resonated about resonance. He wrote a whole book about, I think it's if monsters roar and angels sing, or something like that. And actually heavy metal fans, they often say, some of them say that heavy metal actually saved their lives. And there are some explanations for that, because these one neurophysiological one that we tend to synchronize with these heavy rhythms. Our reward system is very much activated by the music, by the joy of that music, and then the experience of bonding, of social cohesion with others. I'm a metalhead. I belong to this community. And then Wacken is a very, I've never been there, but it must be a great experience to be there, to connect with all these people. And I think these, yes, so we know something, and it's not that different. It's, I think, and even I think we can learn a lot from the experience from metalheads. We can learn something about music, and maybe also in your direction, the openness to enjoy the music and to just yes.
We have a question here.
That answers the questions.
Hi, thank you to both speakers. I'm an artist and with a training in cultural education, and I wanted to give some direct feedback to María about the visit at the museum. I was there last week, and it was amazing. It was very, actually, I've been in Berlin for 20 years, and this is my first time in the Bode Museum, and I went especially for the healing room. And I just sat down, and I'm a visual artist, so I sketched. I actually sketched the pattern from the board, from the floor, because it was the easiest thing I could do in short time. But I found already the sign at the beginning, like here you can relax. It was also giving instructions to the other people not to bother those who were meditating, which I found really interesting, like leave them alone, right? And I actually didn't perceive the QR code and the website and everything. I just sat down and meditated. And while I was there, I realized that actually all the artists who made the art were already mindful and meditators, right? Because they were present in the moment, focused. And that was I mean, I'm an artist myself, but I came to that realization while I was there. And this is something that when one is walking around the museum, which I visit a lot, I don't always think of the artists as the meditators, you know, as being mindful, and which you have to be if you're an artist. And I actually was wondering if there's any way you're collecting feedback from the visitors. I was somehow hoping to find a desk with a card or something, but I couldn't find anything. So that's why I wanted to give this directly to you, because it was just a wonderful. I had like a 20-minute meditation sitting there, and it was wonderful.
Come next week. And actually, and this is true, we are going to install it tomorrow. We had some challenges, and we are going to install tomorrow a box where you can put some papers in. Exactly. And come again and listen to the audio guide and to the meditations, because they help a lot. So then I imagine you walk through the room and you were reading also the labels. No? Okay, so just by the objects. Super, perfect. Y compartimos la misma lengua, ¿verdad? Sí.
Okay. Yeah.
As near as possible. Is it? Yes. Hi. The two tools that you described as healing ones, music and mindfulness, I wondered if you have experiences where it's actually counterproductive and not beneficial in the healing process itself, because I have made both beneficial and destructive experiences with mindfulness, especially. I started meditating in 2020 as well, during the first lockdown. And it was extremely helpful for a certain period of time. And as I became very anxious, it became increasingly difficult, because it was putting an emphasis and spotlight on my anxiety, on the physical sensations. And I had to take a long break with meditating because of that. And I actually came back to it during the chemotherapies that I was taking against cancer. And then it was the very opposite experience. So yeah, I wonder, do you have any knowledge of certain cases or disease where it's actually helpful and others where it's not?
I have a very unscientific thesis, which is myself. So what I have experimented myself. May I ask which type of meditation do you practice? But with the noting technique, or with the body screening? With the body screening or with the note? Okay, I have practiced body screening and the Mahasi noting technique. And from my point of view, for me, the noting technique is, it functions better because it's easier to translate it into everyday's life, into every moment. And actually what I'm trying now, and its function is to meditate on our sitting room while my children are playing or dancing. And this is one of the great things, or sitting on the tube. This is one of the great things of the noting techniques, that every impulse, every moment of life is a meditation object. So from my point of view, I would recommend you to try with this. With anxiety, it works because you would learn to recognize the feelings that anxiety produces inside and to accept them and to work with it. But I'm not an expert on meditation.
Yes, I think your question went directly to Maria, but I think we should bear in mind that music is not always the right medium, and that music is not always wanted and not always appropriate. And I think we have, I myself as a musician, I think music is always great, yes. But I have one experience that I would like to share with you. Another experience with a friend of mine who was in the intensive care unit. Everything went well in this case. She recovered. But I also, because I knew she was a music lover, I played some music for her, and she immediately mechanically ventilated. She couldn't speak. She gave me a sign that I should stop immediately. It was Beethoven violin concerto. And of course I stopped, and then I played, I asked, may I play a different piece? Yes. And I played Leonard Cohen for her. And the director, the Chefarzt, head of the ward, came in and said, how can you play Leonard Cohen for you? That's too sad. That's so sad. Stop that. And we asked my friend, and she said, go on. I gave the sign. It's great. And years later, I asked her, why didn't you want to hear Beethoven? And she said, it reminded me so much of the life I might lose. And I couldn't be that in this moment. And so since then, I know, ask the patients, ask the people. It's not, even if you know he or she loved the piece, it could change in the very specific moment.
I would also like to add something into this, because I've told my story, but the story is a little bit longer. And the end would be that look for that can help you. It doesn't have to be music. It doesn't have to be fine arts. It doesn't have to be meditation. Actually, when I started to feel better, I started to knit. And it helped for a while. Then I found it extremely boring. And then when but I figured out that my brain was looking for something to concentrate, to keep working. And then I went into sports, and I discovered Nordic walking, which is a kind of mindfulness movement. I didn't know it at that time. And 2 years later, I discovered Vipassana meditation. So it's about searching what helps you, but keep searching.
So, hi. First of all, thank you both for these amazing speeches and lectures, which for me personally made a bridge to what is of my interest. I'm a musician, and I have a specific question to Maria, because I have been playing at several concerts at the Bode Museum, because there was a special series between Staatskapelle and Bode Museum, and there was always the music, then one piece of art, which was the piece of the day, so people could enjoy the music, have a special little summit of the piece of art. And of course, for me, both your lectures somehow connect, because of course it's about the healing, the different approach. My question to you is, do you have any plans at the Bode Museum to go further with this? Like, for instance, to connect to other museums? I'm asking for the experience you have, or if there is any plans to perhaps connect your mindfulness and the Healing Museum with some kind of music? Because, of course, from my point of view, it's always that the music can join in. And as you said yourself, you had the Chopin doing good for you. So my question is, are there
I've
any?
been actually working on something like this for many years, how to introduce music into the museum galleries. And there are several challenges. First, how to choose the music. Because if you choose this piece and not the other one, you can be sure that many people are complaining. Then how to make it able so that people who don't want to listen to music also are able to walk through the museum without listening to music. If you have an idea, I'm more than open. And I keep searching, and I want it to be for free. I always, as you have maybe figured out, I always try all my projects to be open to every person, independent if they can pay the entrance or not. And I actually also want to work with modern music.
Well, thank you.
And I can ask Jakob whether there is a question in the chat. Okay.
Hello. I'm a psychiatrist here in Berlin and just wanted also to share a story that moved me very much because we were treating a severely ill paranoid schizophrenic patient for weeks. Yeah, that was very aggressive towards all of us people working on the ward. And it was really hard to, like, with medication and therapy, it was very tough to treat him sufficiently. And he had to be fixated over and over again with police and without. And it moved me really much as his doctor. And eventually I started to talk to his family if we could maybe get some music from his childhood that he liked, and also some, just verses from the Quran to play to him. And it actually worked very astoundingly quick. Within days, we were able to take the fixation down and lower the medication, and it was very moving, and I hope that we can make that a more regular thing, also for psychiatric patients.
And could you tell us something about the music? What type of music was it?
It was strongly religiously related music from the Quran and Arabic music, also rather classical, soothing. There was, of course, also stuff that he later on in his life enjoyed, which ramped him up more than I liked. So we stopped putting those CDs in. So yeah, it moves both ways as well. But also, I think, especially in mental health, it's a lot of people that suffer from different mental diseases have experienced a strong disconnection from life, and also through being in psychiatric hospitals are very disconnected from regular society. And so maybe I would directly also ask if it's possible to have some of those 2,000 free tickets and swing by with a couple of my patients to Bode Museum.
Yes, I would like to respond to the music because I'm fascinated how that you observed the patient and you obviously were aware what he needed, and music to calm down or music to activate, or because we make the experience, and again, your question, is it all about classical music? No, for some patients or people, the confrontation with dark themes, like you have in heavy metal with death and suicide is like an emotional catharsis. They confront but these confront with themselves, and these emotions can be channeled somehow. So I think it's in psychiatry, it may be really a good, very, very important tool to develop. But
No, I just wanted to say, write me an email and I will make it happen.
Yes, hello. Thank you for the talks. And I wanted to contribute to you because it was very touching to hear how you tried to treat that psychiatric patient with music and with music that made him calm down, actually. And I wanted to just give you that information that the history of music therapy goes back to 14,000 years ago and then comes to Egypt and goes to Greece. Hippocrates treated mentally ill patients with music therapy already. And then the Arabs took it and they developed it in the 11th century. And there was Al-Urmabi and Ibn Sina, Avicenna, the one who until the 19th century was like the greatest medical teacher also in Europe. And now it's so great to have this process in Europe starting again and researching how we can treat psychiatric, but all other patients too with this music because it is so connecting us with ourselves. So what I wanted to say is that there was one professor in Turkey and he did a lot of research on this traditional Islamic music. And while they were treating in Turkey in the 70s, they treated psychiatric patients with electroshock therapy. And he was the first one who implemented music therapy to schizophrenia patients in that time. And the patients loved it because it was such a different approach to treat them, actually, because it was done without analgesia and stuff. So there was opened a new way, and I love to hear that there's one person sitting in front of me who intuitively found out that and tried to implement it. So I just hope that you go on with that. And if we can have more exchange, I will be open to that too. So yeah, okay, that's what I wanted to say.
And we go back to one of the first questions about learning, how sad it is that we Europeans have unlearned that.
Oh yeah, I can. Okay. Actually, I also wanted to thank you, both of you, a lot because right now we have been introduced to the concept of music therapy, and I am an art therapist. So I think it is important that in the context we have been speaking for the past time that we all realize that there are those options as well. And I feel a little bit sad that specifically in Germany, these two, and there's also theater therapy, there's many other forms of artistic or art-based therapies that are highly accredited. And as we've just learned, even in history, they go back that far, as you have just mentioned. And yeah, sadly, they're not so much part of our daily practice, neither in hospitals nor in museums. Not in schools either. And I would really like to encourage everyone to kind of, if they have the chance, get in contact with the possibilities. And as we are speaking of the healing potentials of the arts, take it a step further and delve into your own physical experience of painting, for instance, or making music. You don't have to be an artist to enjoy and benefit from those experiences. Thank you.
yes, thank you for the comment. I think it's very important that we have this personal initiative, but it's also very important that we get art therapists, music therapists more into hospital. And for that, we need studies, of course. And I'm very happy that more studies now, really sound studies with larger samples, with well-designed, go on, because I'm convinced that we need the hard evidence, that we need to show with these neuroimaging techniques and lowering cortisol levels, everything, to convince our Krankenkassen insurances to pay for that. And we see these effects, but what we always hear is the evidence is not enough yet. And
sorry to interrupt. No, that's
yes, there are many. Yes, but very often I think you could also respond, my colleagues here. We have many convincing hints, but altogether the results are still quite heterogeneous. I would also say they are convincing. And yes, I know, for example, I wanted to show that, but I won't go back to PowerPoint now because I find the discussion more stimulating. For example, there's one study with pregnant women in the Philharmonie. They go regularly to the Philharmonie and they can show, a colleague of mine of medical psychology, Sonja Entringer, they can show that cortisol levels lower for a long time. And so if we, yes, I think we'll get there, but.
I fully agree with you. And actually, we are working, we will work with art therapists in the frame of the Healing Museum. We're working on that. Yeah. Mm. And at the end of the day, I think it's about convincing the Krankenkasse, the government, that we can save money.
Do you want to? Yeah, is it directly?
Yeah, I'm an art therapist too, and I'm working like since 8 years in the Jugendhilfe. So the point is like, because I'm doing sound journeys and I'm come from Mexico, for me it was very natural to use these elements, but I never told the people what I was doing. So these young people come to me since 8 years and they just know like, okay, I don't want to cut myself, but I don't want to use the skills that I learned in the psychiatry. And then for me, it's now really interesting how to make this happen to these young people, that this just something that they can use every day, but it's not like, how do you say, elite?
Elite.
You know what I mean? Because because I'm an art therapist and I want to be health, I go to the yoga studio because I like it and I know that it works. So all the things that I'm learning, I wanted to try with the young people, but for the young people, it's like, oh, this is too fancy. And it's just really strange. So I think we should work together to change this.
I thought I still think about your comment. I think we need people like this colleague of mine who are aware of the possibilities, and we need to implement it into our training. We could do a lot more. I think I agree with you. But we need some. It's not, as I said before, it's not something we just can apply everywhere and everything. We need to be very conscious. We need to be aware of the situation where we do it, and we need some training. And maybe we could learn from people like you how to do it really in a not this professional way, but how we really can implement it into practical daily practice in hospital.
Hi. So first of all, I want to say thank you to Friederike and Maria for such abundant and rich input, and also for all of the amazing questions. And I want to share something. I'm an artist myself, and I have to confess, I don't go to museums as much as I should. because for me, museums are disembodied places where I come and very quickly I get tired because there is no places where I can rest. I get overwhelmed with the whole amount of like visual things around, because we are living in a time of visual culture and there is like overload of that. That's why I also get really happy that we are speaking about sound and music today. So I guess my question would be more to Maria, if you like, because the project you are doing at Bode Museum, which I haven't went and visited yet, but now after this presentation, that would be the first thing I would do in the next days. So it makes me really happy because I also practice Vipassana meditation. So I'm like, wow, this is amazing that you managed to combine these worlds. And so this makes museum embodied place, and already like seeing that cushions and kind of having this possibility to just like sit down, because usually when we're in the museum there is this almost like a strict rules and you can't really move a little bit to the left, to the right, and then there's like people who are watching you that you have to behave. So yeah, like I feel this when I go. And coming back to the question, if you thought about like any other strategies of making museum more embodied besides the healing arts, the healing museum project?
All the time. Three things. First, when you come to us, please don't forget the audio guide so that you don't miss the limitations. Second, I will never understand why art historians make their best, or museum directors make their best to make museums extremely uncomfortable. Actually, I started first with the project, the Bode Museum, Your Refuge. We work with a partner, Bolia, and they gave us 3 extremely comfortable sofas. They are our 3 islands, helping island in the museum for suicide prevention. Second step were the Tsafus from Futomania, extremely comfortable. And the third thing, something you maybe don't know, but now for some months, or since some months, you have the right in Germany to visit museums barefoot. Yes. Nobody can tell you to wear your shoes. Practice it. Do it. And feel at home. This will be my dream. This is always my goal, that people come to any museum and feel at home. I've been living abroad, so I left Spain more than 20 years ago, and I'm homesick pretty often. So I go to museums to meet old friends, the artworks, and to feel at home. And this is actually would be my goal. And so your question was if I am working on I have other projects. I don't know if you have heard about the Second Glance, which is a series we opened in 2019, in which we work also with the permanent collection, and we connect the permanent connection with issues, social issues relevant to society today. And we started with a project, All Forms of Love, about gender identity. And the second project in 2021, we opened it on women, and we introduced excuse me, all the women, or most of the women depicted or portrayed in our artworks. So yes, all the time. I love it.
There's may I say, a last question with regard to the time and to the clock?
Thank you very much. Okay. I am a musician by myself and also a teacher at music schools. So I was asking myself if there is any studies, if people that experience to make music or learn how to make music or arts in general in their youth or in their life, in their young times, if there's any studies how they are able to carry about themselves much better, or to carry about their mental health better, and also relating to music therapy or art therapy. or if there could be any relation to, yeah, young people getting the skills how to use arts in their life to regulate themselves or anything. Also in relation to the politics right now, how they are cutting all the money for the education of arts and music and stuff.
Oh. I don't know the NACO data, but maybe you refer to that. But I think generally there have been, as you may know, efforts to integrate music physiology into conservatories because musicians don't really care very well for themselves. They practice, they don't think about their movements and their health.
Not musicians by themselves, but about, for example, children that are just learning to play an instrument. And for example, guitar, maybe you learned it in the young times when you just played it yourself. But it's
I give you some.
Yeah. Thank you. I experience it to be that friends of mine that are playing music, if they are just practicing for themselves or playing with friends or something, it's a very big thing of Achtsamkeit. I'm sorry.
Yes, awareness. Mindfulness.
Mindfulness, yeah. Exactly. That they practice it in the young times, that they learn to use, that they have a skill, how to use it for themselves. I'm not talking about musicians.
Yes,
I'm talking about professional
yes,
musicians.
indeed.
Yeah.
I mean, there have been a bunch of studies about the so-called Mozart effect, and that didn't prove really. They couldn't verify that children were more intelligent when playing music, but indeed the ability to be to connect, to be mindful, to there have been very nice studies. I could give you some references of Glenn Schellenberg, for example, a great British study. And these are skills young children learn if they learn to play an instrument, and also to become self-efficacious. They learn that they absolutely want to achieve something because they want to be able to play this music, and it's always a bit too hard for them, but they want to play it. Their reward system fires and then they learn it, and then comes the next step and the next and the next. It has some similarities to sports, but if with music, it's fantastic. And I think it's for children. It's a great training. Every child should get an instrument. But I'll tell you some studies about.
Well, perhaps may I add that we have a large epidemiological study in Germany where more than, I think, 200,000 Germans were examined over a long time. And from this study, we have data on the effect of music making, and we are just in the period of analyzing this data, and it seems that the more hours of music making in life they have, the less cardiovascular diseases they have. They are healthier. But I think one has to differentiate. Many professional musicians come into a direction of too much pressure and stress and something like that. That's why we have musicians' medicine, special doctors for curing musicians that have worked too hard. But it's I think it's a trend in many universities to teach the students also something like Achtsamkeit and to take care of their practicing and something like that. If, for example, the Kurt Singer Institute here in Berlin, which teaches pupils that.
Could make a small announcement because tomorrow Professor Altenmüller, who's the great German Musiker, Mediziner, comes in my seminar and it's open. If someone is interested, please come to our seminar. It's great fun to listen to him because he has a long life of as a neurologist and doctor working with musicians. Yes. Oh, it's tomorrow at 4 p.m. in the 4:15 in the Hertwig Hörsaal here in the behind the Waldauer house. But ask me if I can give you some more specific information.
So.
Yeah. So thank you, Maria. Thank you, Friederike. And thank you to all of you who were so actively making this evening and the opening of the Healing Art series so interesting and engaging. We warmly invite you for the next one, which will be happening on June 4th in 2 weeks, where we have Professor Dr. Benno Brinkhaus with us, an expert on acupuncture, internal medicine, and neuropathy. And we have Cristina Bocado, a Mexican artist and sound healer. And together we will explore how healing is not only a medical process, but also a deeply experiential one, shaped by the relationship between the healer and the patient, the setting, and the power of expectation. So we are very much looking forward to be there with hopefully a lot of you again and to see you then. And if you have more thoughts or would like to connect, feel free to come up to us, and thank you very much.
And the students, please come down and sign your attendance for your credit point.